Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello, everyone, and welcome to the Axxess HomeCare live webinar for today. My name is Lisa Malone, and with me today I have Brian Nelson. We are product managers here at Axxess for Axxess HomeCare. And today we are going to be discussing employee management. So our agenda for today is we're going to go over how to create a new user, and that includes user permissions, licenses, pay rates, match criteria, and then also we will go over the payroll process. And as always, if you have any questions, please type them into the chat box. And we are manning the chat box and we will answer any questions that you have. Alrighty, so we'll just go ahead and get right into the presentation. So you can see I've already logged in to Axxess HomeCare, and I'm currently on my dashboard. To create a new user, we are going to take a look over the View menu, and we can scroll down to Lists. And you can see that right here, we can see a list of users. Now, as usual, there are several ways to do many things in the HomeCare application. We could also, if you have access to the admin tab, there's also a lists there where you could add a user. They'll take you to the same place. But as we've discussed in previous webinars, everything is permission and role based in our application. So you may not see the admin tab if you don't have administrator permissions, which many people won't. So the best way would be to go hover over View, go to Lists, scroll down to Users, and then you would open up this list of users. So users are your employees or users of the system. And this would be a list of users right now. You can filter that, active, inactive, terminated, or deleted. But if we're going to add a new user, we can scroll over here to the right and select New User. And when we do that, it'll open the New User site where you can start entering information for your new user. You can see that several things have the red asterisks, so those, of course, are required. And instead of entering some data in here, I'm going to go ahead and just go to an existing user and show y'all. We will go right here to this user. So we've entered the name, gender. You can select various languages that this user speaks. You'll enter their date of birth, and once you do that, you can check for user conflict to make sure that you don't already have this user that's already been entered into the system maybe. So after we've selected that, we do receive the message that there's no conflicting users found. We can enter the other various information, demographic type information here at the top. Then we would go down to the other information section. In this section, we'll enter the user's credentials, and we do have a long list of credentials, as well as other if needed. You'll enter their title. Again, we have a long list of titles to select from. You'll be able to select whether this user is an employee or a contractor. And then we've got a few areas where you can enter a clinician NPI number. You can also enter a clinician other provider ID for some of those payers that require a secondary provider ID. There's also your employee ID. You can give your users access to multiple branches. If your agency has multiple locations or branches, you can give each user access to either one or multiple locations. So I've got access here to 2 locations. The hire date, any tags. So this is where you can enter in different items that you want to just track. Both users, and then you can also enter these tags for clients. So I could enter a various tag right here. One might be the area of town that I live in. Oh, and you can see there was a tag already for North, so I can just select that. So I could search through my employees for all of the users that live in the North area just by searching for the North tag when I go to the client center or employee center. Next, we have the maximum time and overtime. So currently, we've used the agency defaults. Now, this has already been set up in company setup for the entire agency defaults. So that is pre-selected for us. If different users have different maximum time or overtime limits, then you can enter those for each user here. But if not, then you would want to go ahead and use the agency defaults. The next section is the system roles. Now, this is an important section. It doesn't seem like it, but it really is. It has various roles that a user might play. What you want to do here, and if you hover over, of course, at any time, you see a little I info with a circle around it. That is a little tooltip that kind of lets you know, gives you a little further information as to what you should enter here. So if you hover over the tooltip, you'll see that you really should select one role in the system, and this should be the highest role that the user plays within the agency. So in many cases, an office manager, you might want them to be able to, that they are maybe a nurse, but you also might want them to get into the scheduling. They might also be the director of nursing. They might also function as a case manager and an office manager. You would not want to select all of those. It really kind of throws off the system, and the system is confused as to which role they should set, the system should set for this person. So you want to choose one, and you want to choose it to the highest role that user performs in the system, not necessarily their title. So as an administrator, that means that I have access to a lot more than office staff. This is also where users will be restricted to, let's say if it's nursing or home health aide, those users would be restricted to only see clients that they have been assigned to. They would not see an entire list of the agency's roster of clients versus an office staff or biller or scheduler. Those internal type roles for the agency, those would be able to see all clients. Okay, next we're going to scroll down to access and restrictions. So you are able to restrict login for users. So here we've allowed this user to get access to the system on weekends, You may have some users that you do not want to access the system on weekends, so you would uncheck that box. You also can restrict the times that users log into the system if your agency would like to do that. There's a trial account you can give someone, but that's not typically used for an agency. So let's go, after you would enter this information, you would save and go to next. And next screen we come up on is permissions. The permissions are really, as we've said in probably every single live webinar, the permissions are really what drives what users are able to do and see in the system. So, and the permissions all kind of default to open. So I'm going to just close them here so that it's a little easier to look at. There we go. So these are the basic permissions, or kind of the categories of permissions. This is what will take a little bit of time to figure out, right? When your agency begins using Axxess, is what permissions each person or role needs to be given. But once you do that, we have created a nice, easy way for you to add more users and copy permissions. And I'll show you that in just a minute. So for the Alert Center, there are permissions for Alert Center that you may or may not want to give to everyone. So as you remember, the Alert Center is this area where you can see who has arrived late or left late from a visit, late EBV arrivals and departures. So for anyone doing scheduling, you'll probably want to give them those permissions. For a nurse who's performing visits for you, you probably don't want to give scheduling Alert Center permissions. So we've also got human resources and then user Alert Center permissions. So that would be what drives these. Each one kind of opens up, and then you can select specific permissions that you'd like to give to users. If we open up the administration, it's a pretty big section. So this is, as you can see here, payroll. This isn't necessarily the payroll permissions, but it is in the administrative tab, the permissions that go along with payroll. So upload types. This isn't uploading a document. This is creating, adding, editing, deleting the types of uploads that can be performed. There's personnel notes, blank forms, treatments, creating a treatment log. For each item, when you select it, you can see that there's further permissions, because you may want someone to be able to add a treatment, but not edit a current existing one and not delete one. Or you may want to give people visibility to be able to view the treatment list or the log, but not add, edit, or delete. Got some billing permissions here for managed care and accounting close. Got clerical. And in the clerical permissions, so this is where you'd be able to, let's take a look at client. You'd be able to add, edit, delete, restore client information, export, view the list of clients, change the status of clients, also admit, non-admit. So you'll need to go through many of these. You won't want to give all permissions to every user, but you might want to give view list to several users that can't actually add a client. I want to highlight really quickly here the schedule in clerical. This is where edit notes, this is where users will be able to get into the documentation and edit that note. So if this is someone who's going to be doing documentation in the field, you are going to want to give them edit notes in the schedule. that permission. Viewing sticky notes, you're probably going to want most people to see sticky notes since you're letting them know different information with those sticky notes. Then there's some clinical permissions that you may or may not want to give to various users. There's also some QA permissions. So this would be who can take a look at QA, who can approve or edit QA, who can return documents to the users who submitted them. There's also a bypass QA button. So for someone like your director of nursing, or maybe a clinical supervisor, or maybe that rock star home health aide or nurse that has been on staff with you for the last 6 years and you know their documentation is amazing, you can select to bypass QA, and that way their documents don't flow to the QA center. So you obviously wouldn't want to do that with everyone, and you probably would not want to do that with new employees. But once you've decided that all of their documents don't need to go to the QA center, you can select bypass QA. And then, of course, you can filter down with what types of documents you want to bypass QA. Let's say you do still want to see everyone's orders. You can leave, you can not check the orders to bypass QA. And then there are the reports permissions. And so many of your employees will not have access to those reports, but many of your internal employees in the agency will have access to those. All right, the next tab is licensing compliance. So this is where you'll be able to, for each user, enter their license or any compliance documents that you would like to keep track of. So we can enter by selecting new license or compliance. We can enter a license number, the type of license, and we've called it license, but it may be various items like a chest x-ray or a competency skills checkoff, or a HIPAA certification that you annually have employees complete. You'll select the category, whether that's licenses, compliance tracking, or maybe CEU tracking. The state of the license, issue date, expire date. So the time frame that the license is good for. Let's say this license began on January 1st. We can then select time frame, and if it's a 1 year, expires in 1 year, you can just select 1 year, and that will automatically populate in the expire date. You can upload an attachment of the document. So if it's maybe somebody's car insurance, you can upload their face sheet for their car insurance so that you've got that attached right here. And then at the bottom, you can see we've got alert user and alert HR. So that goes back to that alert center. If we select alert user, the user will get an alert in their alert center. Once we select that, you can set how soon before the expiration date of that license or item you would like the user alerted. So we can set an alert for 30 days before the expire date. And if that's what we choose, we can hit select or set, and then it will automatically populate the alert date. And on that date, the user will get an alert in their alert center. Same thing for alert HR. We can do that for your HR, human resources folks that are manning the alert center for your agency. So that way the user is aware that their license is about to expire, as well as your HR team. Next up is pay rates. So we have already entered under the admin tab in company setup. Your agency should have some default pay rates that have been entered already. So for the most part, you pay everyone this amount for this type of visit or task, and those are defaulted. If that is the case for this user, you're going to pay them the standard pay rate for a home health aide care plan process visit. Then you wouldn't need to do anything here. We've already entered that in company setup and it would default. If you have someone that you've agreed to pay a higher or different rate to, then you can set here specific user pay rates for different days of the week and also various tasks or visits that they perform. This user doesn't have any specific rates in here, only the default rates. Next tab is the match criteria. In the match criteria, these items that flow here to the match criteria, again, have been already set up for your agency during the company setup phase in the admin tab. And so you'll go in for each user and select which match criteria they have, what skills they have maybe, what transfer abilities they have for transferring clients. Maybe they are certified to use a Hoyer lift for your agency, or they're able to transfer 350 pounds. Then you could select that for this client or for this user. And then if not, you wouldn't select that one. There's also personality traits, pets. Maybe someone is allergic to cats or dogs, or will absolutely not work with snakes in the home. Then you can filter with that by selecting the various match criteria. You'll also select match criteria when entering your clients, and that's how the system is able to match up the perfect caregiver to each client with the match criteria, what skills, personality traits, or specific criteria is needed for each client. And you'll just go through and check those as needed. Next tab is availability. This is the employee availability. And here you can just drag and drop what their availability is. And lastly, we have the immunization tab. So if you keep track of various immunizations for your users, maybe a TB test or the flu shot, you can add an immunization here by selecting Add Immunization, enter the date and who administered and the type, and then save that. All right, I just realized that I did not tell you the easy way to add permissions to typical users. So let me go back to the permission tab real quick. So once you've set up the various permissions that you'd like for the majority of your users, or for this user specifically, let's say, when you enter a new user, you'll see that there is this copy permissions from. And when we select the down arrow, you'll see available employees that we've already set up permissions. So if you want every RN to have the same permissions as Amanda, or if you would like this user to have the same permissions as Amanda Morales, RN, then I can select her name and then select apply, and it will change my permissions to exactly what Amanda had. So that gives you an easy way to add a new user and then just clone the permissions from a user that's very similar. All right, that is entering a new user and each of the tabs for users. Are there any questions about entering the users or any of the items that we just went over? If so, you can type them right into the chat box. And we are happy to answer those. And if not, I am going to let Brian go over the payroll process with y'all so that you can learn how to do payroll.
Thanks, Lisa. Hi, everyone. As Lisa said, my name is Brian Nelson. I'm one of the product managers here at Axxess for the Axxess HomeCare product, and I kind of specialize in the operations. So as Lisa said, we're going to go over the payroll process. So this is assuming in company setup that you've set up your payroll process. How we have ours set up is to run weekly. Within company setup, you can change that to be bi-weekly, monthly, things like that. So, but for today's example, we're just going to operate as if it's weekly. So I'm going to go up here to employees and then select payroll. Then when I do that, our payroll screen will pop up. And so this is kind of where you would go to begin the process of processing payroll. You can see here we have defaulted to all branches. So if you have maybe multiple locations spread out throughout a state or throughout the country, you can process your branches payroll individually, or you can group them all together. For today, I'm going to keep it at all branches. Here we have late tasks. So I know as a former operator in an agency that's always difficult to get notes turned in on time, or there might be some questions about the validity of the notes, and you have concerns about paying the caregiver for that shift or for that visit. So here within the HomeCare product, you can either include late tasks, exclude late tasks, or only show late tasks. So it kind of leaves it up to you about how you want to process these items. And so for today's purposes, I'm going to go ahead and include late tasks. And that just means that it's going to go back and pull anything that I haven't paid that's outside of the pay period. So next up is I'm going to select my pay period. You can also create a pay period, but I am going to select last week as my pay period. And you'll see that it changes. It removes this date range option. If you leave it on custom, you can set up a custom date range. And this would be if you wanted to, pull payroll for 2 weeks or 3 weeks and kind of do something off cycle. But since we have it set up week to week, I'm going to look at last week's pay period. Next up, we have the task statuses. So in general, most of our agencies are only going to be paying caregivers based on submitted tasks, but we do have several other task statuses that you can also pull into payroll if there's some extenuating circumstances where they need to get paid. We also have the ability to pull in incomplete, missed, and future tasks. So if for some reason, I know, again, whenever I was an agency operator, we actually paid some tasks payroll in the future whenever we knew we were having a major weather event moving through. We had a hurricane coming for one of our offices. So we actually went ahead and kind of best guess pulled in some future tasks and then paid those caregivers for those dates so we could get ahead of that. So, but for today's purposes, I'm just going to leave it on completed. And that's, again, what, 90% of our agencies are doing the majority of the time. Then we have employee type. And again, you can toggle back and forth between all, employee, or contractor. I'm going to leave it on all. We have payroll statuses, and that'll make more sense once I generate the payroll here, but we can look at payroll that's not finalized, not paid, or paid. Right now, I'm going to select it at all. Essentially, we're really going to be looking at the not paid as if you wanted to kind of pinpoint the parameters, but again, I'm going to keep it at all just so we can make sure we got some good information. Next up, we have columns to display. So There are 6 different items that are defaulted to display. So that's the employee, the client, the payment source, the task, the actual date and time, and then the hours. We also have the ability to pull in any of these other columns that you might want, or all of the columns that you might want. So I'm going to go ahead and check all, and then that's going to give me things like the rate, the EVV time, hours, some of the payroll categories, the client ID. So you just get additional information than if you just have the 6 columns selected. And I am going to do the employee task sort by date and not client. So you can either group these by client or by date. I'm going to leave it as the date. Once you have all of these parameters selected how you want it, you'd go over here to refresh. And then that's going to generate your payroll. And then you'll see here that we have for our employee here, Rupali, who's one of our awesome QA specialists here at Axxess, that she has set up a few different items for a client, Brian Johnson. And we can scroll to the right here and see how many hours she's have scheduled, what the rate is per the hour. She's also applied a municipality, and that's where if maybe you have a higher rate in a specific area of town. Let's say I know a lot of cities and some states are passing specific minimum wage rules. You can apply that there in municipality, and that's in company setup. And then it's going to give you the total amount. So on this screen, we can select Edit Payroll. And then that's where you're able to change any of the date and times that you need to. So if there was an error on your caregiver's note, or maybe you promised them a rate that was $1 more than normal, you can enter that in there. And so you're able to edit any of the shifts that you would like, and then you would just select Save after you've edited it. So I'm going to go ahead and cancel the edit. And then we're able to finalize payroll from this screen. So that would be, you've looked at payroll, you've made any of the necessary changes that you would like, and then you would just click this checkbox up here at the top, or you can do it per employee as well, and you would finalize payroll. So you'll get that message there that says the items have been finalized. If for some reason you think, oh no, I made a mistake, I need to go back and look at something, you can unfinalize payroll, or to kind of complete the payroll process and to generate the email that will send the caregiver their pay stub, you would select Mark as paid. And then, and then you would select Send Pay Stubs, which would send the pay stubs. So that's kind of the payroll process in a nutshell. Any questions on that? All right, and then I did want to just show a few items in the report center. One other item of note is that whenever we're in the payroll processing screen, you might have a third-party vendor who does your payroll processing, generates the check. Whenever you're done and have all of this how you want it, you can go to Export To up here at the top, and we have the option to export into an Excel file or a CSV file, and you can just select those options, whether you want, again, that Excel or the CSV. It will download, and then you'll have access to that information that you can then upload to that third-party vendor or email to them. You're also able to make any changes within this file export. If you need to move some of the columns around to accommodate their needs, you can do that here. And again, whatever columns you select here on the columns to display, that is what flows to the Excel and the CSV. So If your vendor that you're using has specific requirements or maybe doesn't require some of those items, you would obviously probably not select those whenever you generated that to export to them. But I did want to highlight just a couple of things in the report center. So we have a lot of our billing and financial reports here. We do have a payroll summary over here in our employee reports. And then one of our employee reports I kind of wanted to highlight is the employee compliance report. And this goes back to a little bit what Lisa was showing you earlier. You can set up the parameters where you're looking at different statuses, different credentials. Here I want to look at all of our employees. And then we're going to basically be able to take a look at anyone who has an upcoming expiring credentials. So I'm going to set my parameters out a little bit here. So I want to see everybody who has an expired credential through the end of the month. Similar functionality before, you're able to pick and choose what columns you want to display. I'm going to select all and then generate that report. And then you can see it's sorted per employee. So I'm going to select Matt here and see that he has quite a few items that are expired. So some that are expiring in March, some that were in December, some in February. And so what I can do from this screen is I can actually select Matt's name and then send him an email. And he'll get a message in his message center that lets him know, hey, you have, these 6 things that are expired. We have questions about that. And please contact the office to let us know when you're going to have that rectified. So I think that's something that saves the agencies a lot of time. I know, again, in my time in an agency, we spent half of our time calling people, emailing people, texting people, letting them know that they had different compliance items expiring at different times. And so this just kind of sends that all in one nice, neat package right to the caregiver that you're interested in. So that'll conclude kind of our overview of employee management today. Any questions out there?
No.
All right, great. Well, thank you all so much for hopping on today. Please make sure you look at our upcoming webinars and register for any of those topics that you might need a little bit more information on, and we look forward to talking to you then. Thank you so much.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.